welcome you today to our home. We are the original inhabitants, have been stewards of this land with a profound relationship to the valleys, mountains, and streams, what we now call Morongo. This land has sustained our ancestors long before European contact. Our people prospered and survived on what foods the desert and streams provided. I hereby acknowledge that we are standing on the beautiful traditional territory of the Cahuilla, Serrano, Chemehuevi, and Digueño people who are the original caretakers of this region. It is here that we practice our ceremonies, songs, and dances to this day. Every day we pay our respects to our strong, resilient relatives, past, present, and future, and recognize the legacy and many contributions they made. We honor the many ways our culture and traditions have continued to have significant impacts that remind us about the sacred and spiritual relationship that exists to this day. Thank you very much. I would like to thank Assemblyman James Ramos, who is also a cousin. Some of the Morongos traveled to San Manuel and intermarried there, but I wanted to make him a gift of thanks and acknowledgement today for his efforts, a rattle and a gift of sage, so that he can cleanse, take away bad spirits, bad thoughts, anything negative in the area, and ask him to sing us a Cahuilla song.
Thank you. This song's about the earth, Demo. Amale, Tamaloa, Tamale, Tamaloa, Tumani watu Tamale, Tamaloa, Tamale, Tamaloa, Tumani watu Tamale, Tamaloa, Tamale, Tamaloa, Tumani watu Tamale, Tamaloa, Tamale, Hamaloa, Umani watu Tamale, Tamaloa, Tamale, Hamaloa, Umani watu Tamale, Tamaloa, Tamale, Tamaloa, Tumani watu Tamale, Tamaloa, Tamale, Tamaloa, Tumani watu Tamale, Tamaloa, Tamale, Hamaloa, Umani watu Tamale, Tamaloa, Tamale, Hamaloa, Umani watu I just want to thank you, Marianne, cousin, for opening up this area, and I want to recognize Mr. Robert Levi, who taught us those Cahuilla bird songs that we just sang. Give them all a round of applause there.
I gave the children's rattle to him so that we can acknowledge that it's the songs and the customs of our people that are going to bring our children back. I always tell the young boys, the girls like the bird singers, so learn how to sing the bird song.
Well, thank you so much for being here today, and this very much needed discussion here in Indian country around striving for zero suicide prevention and mental health components here. We just want to continue to acknowledge that the voice of California's First People is engaged in the discussion moving forward. We introduced the Office of Suicide Prevention through a bill, AB 2112, that was authored and passed into law in 2020 that moved forward to identify areas in the state of California on suicide prevention, mental health components. And specifically, the bill was able to dive into areas of demographics where we've seen spikes in suicide. And some of those areas included LGBTQ plus persons, veterans, adults and Native Americans and youth of Native Americans, where we've seen that spike continue to move forward. The Office of Suicide Prevention has been hard at work creating and coming to terms with those requirements in the bill itself. And so what we want to do, and the caucus, the Native American Legislative Caucus, wrote a letter asking specifically how the engagement with California's First People was taking place during these discussions, where we talked about a collaborative of understanding of ways in which California's First People navigate through challenges and can shape the way in which mental health professionals deliver their responses and preventative interventions. Here in the state of California, and now being in the state legislature, a lot of times when we start to talk about California's First People, tribal governments, sometimes departments and counties see that as someone else's responsibility. But in the state legislature, we're making sure that the whole state of California understands that it's the responsibility of the state of California to be able to deliver resources in times of need. So we continue to lift those areas up. Also, areas in the letter that we sent identified requests and seeing if there's ways to have a voice moving forward with different ideas. We know that Prop 1 funding has now moved forward, so we want to make sure that California's First People are not left out of that equation, especially when the makeup of those committee members is being discussed now, that we would rally around and try to get Native American people to apply for those positions that are there, and would lead to hopefully having a state tribal advocate for behavioral health services is something that's drastically needed. Allocations for ensuring that appropriate tribal engagement efforts are made that are tribally led directives, just like those around this dais now, that their voices are around the table, making sure that people understand how to engage with the tribal communities throughout the state of California. And also receiving an inventory of resources available to tribes that a community can access together or as a tribal government, such as grants or other collaborative efforts that may be identified here today. This is a chance to be able to have that voice heard, and certainly moving forward to have that liaisons within the tribal governments to be able to have that voice of what's drastically needed, but also what works within Indian country. Certainly 988 has been something that we had a hearing here a couple years back, and still the need to get that awareness out there to others is still needed within Indian country. So with us today are tribal leaders that have taken the time to come our way. And I'm going to open up the dais for them to specifically talk about the issues that they would like to see the state and the agencies identify, as well as through Prop 1 funding. And so it's always best to be able to have that moving forward. And then we'll have, after the tribal leaders speak, we'll move into the California tribal chairpersons. And then after that, we'll move into the Public Health Office of Suicide Prevention and those needs, where we'll have the California Health and Human Services Director, Stephanie Welch, speak, and then the California Department of Public Health Assistant Director of California Department, Christine Sayador, speak, and then Mental Health Services Oversight Accountability Commission. With us today is Mental Health Services, Toby Ewing. So first we'll start with tribal leaders on the dais to be able to talk about what potentially can work and the needs in Indian country. And we'll start with the Cahuilla tribal council member who's here.
Achma, I guess I want to start out. I always prepare comments and then I don't stick to them because I try to speak from the heart. So that's my first apology. But thank you so much for allowing me to be here today and to share some of my thoughts with you. I'm Samantha Thornsberry. I'm a tribal council member for the Cahuilla Band of Indians, but I think the equally important role that I play is I'm the program director for the Cahuilla Consortium Victim Advocacy Program. And so we provide advocacy to all the indigenous community in Southern California. We started out with Riverside County and we've grown. And one of the things that I always like to talk about is that this is a causal chain that that we arrive at when we see an impact like the high rate of suicide in our communities. It's not an if-then situation, or we didn't get here on a slippery slope. There's many things that are in this causal chain that are braided together that you know, have gotten us to this conversation. And that includes what I see a lot in the day-to-day work that I do is violence and victimization against Native American people in our communities. And so when I talk about those impacts, there's always this cross-section of many things that occur that causes mental health disorders, drug and alcohol disorders, medical issues, and then it can lead to the vulnerability that make our people open to victimization. So there's many factors that come together that we're always trying to combat. And the other thing I wanted to say just briefly in the way of introduction is it matters to have someone like me in my community that is that liaise between, and I use this word, and I hope I mean no offense by it, with outside services. Because as part of, you know, decolonization, we're still combating that distrust of the outside. And I just got through saying this at a meeting last week, then I just had an experience where someone walked into our office just yesterday and they didn't want to talk to anybody else except me, Sam. And it's not that I have all the know-how and the knowledge, but it's because of trust. And I think I'm okay with brownouts because I live up in stress. But that's part of one of the things I wanted to say about living in a rural community and access to services. Sometimes it's tricky in transportation. It took me an hour and 40 minutes to get down here today. So just accessing services, but then that points to the distrust that many of our community members have. So it's important that our leadership and the people that work within our community, our own people, are at the forefront of creating these plans so that we're truly part of this collaborative effort. I guess it's my opening remarks, and I hope I can bring more to the conversation, more information as we move forward. Thank you for allowing me to be here today.
Thank you. Thank you so much, and for identifying the access and the remoteness of many tribal governments here in the state of California. Out there in Cahuilla, out in Anza, and those areas are pretty hard to get to. So we need to make sure, as the discussion moves forward, that the access and availability to those resources within California's First People is something that's brought into the equation. Now I'd like to recognize the chairman of the Saboba tribal government, and he'll recognize his council.
Good afternoon, everyone. My name is Isaiah Vivanco. I serve as chairman for the Saboba Band of Sandy Indians, and today I have with me our vice chairwoman, Geneva Mojado, and our secretary, Monica Herrera. I'd like to start off by saying, thank you to Morongo for hosting today. I appreciate that, and also to Assemblymember Ramos for bringing such critical issues to the table. Here we are in Saboba, about 30 minutes south of where we're sitting today, and have experienced these unfortunate issues in the past couple of years. We've had incidents where young members have taken their lives, and without any kind of awareness to our belief, it was done. And we believe that this critical issue needs to come to the table to help members, help communities with identifying individuals that may be in a struggle for their life. We don't know. We need to support the mechanism out there to help us identify these issues. We know a lot of it has to do with historical trauma. There could be issues at home. There could be issues with drug abuse, alcohol abuse, so on and so forth. But we need to take that stance as a community, as Indian peoples in California, and bring it to light. Bring this awareness to our people to make sure that we don't lose another member. Life is so precious, and when we have young ones taking their own lives, it has to bring awareness. It has to raise the issue of what's going on and how can we identify and help these individuals. So I appreciate the state looking and bringing to the table today what they have been working on. We're curious and excited to hear what's going on, but we would really ask that you really don't leave Native communities out. Make sure that we are in consideration for these dollars when it comes to that, because we need the support as well. Not only with, I mentioned our communities, but our families. They're the ones that suffer through these crises, and it's really important that we raise this issue and keep it at the forefront to make sure that we don't lose another member. So thank you for having us here today, and we look forward to the discussion. I don't know if Geneva or Monica, do you have anything to add? Or?
Good afternoon, Geneva Mojado, and thank you, Morongo, again for hosting, and Assemblyman Ramos for having us here today. I used to work for Native Challenge at IHS right here on the Morongo Reservation, and I'm very fortunate to be able to be trained in programs like Safe Talk or First Aid Mental Health to be able to work with our youth. And I think that's what we need to strive for within our Native communities, is being able to teach our youth on how to identify some of these suicidal tendencies or factors or things that they're going through. If we can train our youth to be able to do that, to identify their friends, their family, whoever that may be, I think that's where we can start. Very fortunate to have, Indian Health get grant monies to be able to fund Native Challenge, but those grant funds end within 2-3 years, and sometimes they get renewed, sometimes they don't. So we definitely need the dollars, be able to reach our youth, teach our youth. I want to give a shout out to my old boss out there, Les Rillicante, and to our CEO, Mr. Bill Thompson of IHS right now too. But to IHS to continue to, seek those grants and fund those programs. But the state of California can do a lot with that too as well. So just wanted to put that out there. But it is within our community, it's a lot with like Chairman mentioned, historical trauma, childhood trauma that leads to drug and alcohol abuse, and then eventually mental health issues. We have a tribal member specifically, and you got a tribal member who could be dual diagnosed, whether it's mental health and drug abuse too as well. And you have a lot of facilities that don't treat those kind of individuals. So you have to be able to find those places, and also culture is healing too as well. So taking these tribal members to these facilities, sometimes they don't recognize that they are Native American, and that Sweat Lodge or praying or some type of cultural healing is not, not encouraged, but they just, we can't take you to the Sweat Lodge, it's against our policies kind of thing. So I think having some treatment facilities be more more knowledgeable to what our healings are and what our teachings are. So I think those could be some good points to add to in treatment facilities. Thank you.
Thank you so much for that, and for bringing to light that this is something that's still happening in Indian country, with young ones taking their life and identifying substance abuse that could be a catalyst to some of the processes that we're talking about here today. And I just want to thank you for that from the Soboba Tribal Government. Now we'd like to hear from our host and former chair, Marianne Andreas of the Morongo Tribal Government.
Thank you. I agree with the tribal council member from Kauai. We tribal members, Indian tribes, have been literally studied to death. More studies have been done on us than any other people in the country, I think. But we fail to see any results. I can tell you from experience, the saddest thing in the world is a failed suicide attempt. A young person who tried to hang themselves, didn't kill themselves, but was without oxygen for so long that they're no longer functional. A young person who tried to shoot themselves, but didn't kill themselves, and maimed their body so badly, their face so badly that, they don't go out anymore at all. I mean, suicide is bad. Failed suicide is even worse. And we always say here at Morongo, you can walk through our cemeteries, and all the new graves are young people. Our elders are living in their hundreds, but our young people are passing younger and younger. I think training for the parents is so necessary. I know we go out and do Narcon training, and they're confused. They have no idea what's out there. They have no idea what the kids are talking about. They have no idea, you know, what the world is out there for their kids, what's available today. You know, I can tell you that growing up on Morongo, we were all poor. Every one of us was poor. So we didn't know that we were poor. We thought everybody lived like that until we went to public school. And then we realized we were different. We didn't have the same clothes, the same shoes, the same everything. We were different. And I think from that day one until you finish, you're different. I mean, I can remember being in classrooms, being the only Indian student in the classroom, and the minute they talk about Indians, everybody in the class turns around and looks at me. And it's, you know, it's just comes with being an Indian, I guess, but those are some of the experiences that our kids are still living with. I think that boarding schools, intergenerational trauma from boarding schools, all of us are a child, a grandchild, or a great-grandchild of someone who went through boarding school. 100 years ago, my mother was taken, and her family were taken by force to boarding schools. They spoke their Korea language. By the time they came back, they couldn't speak their language anymore. They were beaten if they spoke their language. After she came back and married my father and had us children, she fell ill and was taken away to Arizona to a sanitarium, and the rest of her children had to go to boarding school. That was me, my older brother, my older sister, and for 3 years we were there. So we all go through that experience and hold those memories and things that happened to us and we saw happen to others, you know, stick with you for the rest of your life. My mother didn't talk about it much. I never could figure out why she remained a Catholic, but I guess that's a discussion for another day. But those are some of the issues that our children are trying to resolve by themselves, and we need all the tools that we can get to help them find themselves. And I think the cultural aspect is one of them, one of the tools that we can use in understanding. You know, I'm proud to say that this year, every year when we passed a law several years ago that says if you don't graduate from high school, from an accredited high school, you don't participate in any benefits of the tribe. So abracadabra, we went from 0 to, I think we had 37 this year. And we take the pictures and we line them up on the road coming into the reservation. And it's a very proud moment for those children and for their parents and for our whole community. And I think more days like that need to happen so that our children have that pride. And we include the kids that graduate from trade schools as well, because not everybody's cut out for college, and we don't want them to feel any less than anyone else. So those are all things that come to my mind, seeing things that happen firsthand. I know one of the biggest funerals I've ever been to in my life was a young man. It was a mile of young kids, and it was one of the saddest thing I ever saw. So we have to do something, and I thank Assemblyman Ramos for taking this on and bringing it to the attention of everyone. Hopefully we can come up with some results this time.
Well, thank you so much, Marianne, for bringing that up. And the issue of the most studied people here in the state of California, if not the nation, but there's so many studies that have been done on our people, but where is the works of that study? So what you're hearing is frustration, but also historical trauma that still plagues our people. That's why you see the statistics higher within Native American communities than others in the state of California because of that historical trauma, those studies that have come in, but no results coming after that. And Geneva Mojado brought it up that when funding's there for 1 year, 2 years, and then it goes away, the promise of trying to bring some resources forward to bring light within the community then gets snatched away. How are people supposed to depend on those resources moving forward? And so these are areas that, why this hearing is meant to bring those voices forward of what you're hearing from the tribal communities. Next, we'll hear from Torres Martinez, Tribal Chairman, Chairman Torres.
Thank you, Assemblyman, for having me here. It's an honor to be here before Morongo. Thank you, Councilwoman Andreas and Chairman Vivanco and Vice Chair Geneva and everyone here. Thank you for having me here. We're talking about the mental health and wellness of Native Americans. I think about the world has had attempted and successful genocide throughout history, and those cultures and people that have survived are, rebound and rehabbed and have rights to practice their culture and different ways, that Native Americans have had not the ability to do so. When we talk about Native Americans, when we were able to, our ancestors were able to be self-sustaining, to hunt, to harvest, to be able to provide for our people, and that was all taken away. And then when we talk about, now we have, TANF programs and all these, but we see these as a cycle of dependency that was created by the government years ago when we were, relocated and they said, we'll take care of you. That created this beginning of cycle of dependency. And as Torres Martinez, we discovered we also did that, not unintentionally. When we started the TANF program, which is supposed to be taking over welfare to work program for our Native American brothers and sisters, and a way to get them back on their feet with the cultural, implementation. We said we can do this, but with an addition of helping train, and educate our people in the Native American ways. But we discovered that now this is another cycle of dependency, and we had to work at, bettering that. And one of the ways we did that is, working with the colleges, universities, building pipelines. And I appreciate the fact that, I talked to, Morongo and Saboba, and they told me that you have to create these things before you, start handing out checks, or you're going to continue this cycle of dependency. And so one of the things, like I said, is like we work with the California Nation College, which provide tuition-free education for Native Americans. It doesn't matter where you're from. And for Torres Martinez, we've had single mothers, at least 24 that have graduated from the school, and they are total success stories that they would never have that chance anywhere else in the world. I mean, to have, a parent that, is struggling and then go through our program and of, welfare to work. But once you complete that, there's no work. So then if you are offered education, now they have a tool to manage and become successful. And all of this is done with the cultural aspect. We make sure that cultural and traditional ways are still implemented. They're still taught so they can teach their children, and those children can teach their children. So when we're talking about mental health and wellness, I think getting away from the cycle of dependency that's been implanted in our way of thinking, we need to get away from that. And back to like what the leaders have said here today is going back to respecting our ways, our traditions, our cultures. And one thing I want to say in respecting culture and tradition was taught to me by my father, and I think it speaks volumes. When I was very young, probably 10, before I was in middle school, high school, we lived, in an area where there were a lot of people coming and knocking on your door and trying to express their ways. And my father said, well, I'm gonna teach you something, son, about respect of your culture and your tradition, and not only yours, but other people. So one day, these people that come knocking on your door, he let them in. He invited them to our kitchen table and offered them, whatever they wanted to drink. We had, sandwich, fried beans, rice, whatever we had that day we were eating, and offered them food. And then like we do, we traditionally feed before we, do anything. So he did that. And then he listened to the people who were talking about a story of creation. and they were talking about how a way of life they believed could save people. And my father listened and, was interacting with them and asking them questions and offered me the time to ask them questions, so I did to the best of our ability. But then towards the end, they wanted my father to, say some words and to change his ways, per se, and they went and so were adamant to say that his ways were wrong, that our ways were wrong, and that if we didn't, that my father would be condemned and his life would be hard, and his life would be condemned in his afterlife. So my father, started, he kind of holding his tongue the best that he could, but he's native, that drank and was in that ways. But so when the time came that he thought that it was the end, he said, it was a man and a woman. He said, well, I've listened to you with my son, and I've listened to your story and your way and your creation story. He goes, I would like to get your name and your address and your phone number. And they're like, sir, what for? And he was saying, because out of respect, I believe that there should be an openness and a respect for both ways of culture. I want to come to your house where you can feed me and sit me down, and I want you to listen quietly as I have done for you, and listen to my way and my tradition and my culture and my history, the ways that my ancestors have taught us and the way to live. And I want the ability for me to try to tell you to change your ways and live the way we have for thousands and thousands of years. And, they were like, no, sir, we can't do that. That's just not what we're allowed to do. And he says, you're going to say that in front of my son, who I'm trying to teach respect for culture and tradition of all peoples. And they're like, sorry, we're sorry, sir. He says, well, then I'm going to have to respectfully ask you to leave, because we're going to continue to live the way we are, and you're not going to change us, because this is the way that my grandfathers have taught us, and I'm going to teach my son that way. So that taught me to have respect and openness for all cultures. But, in that way, my father taught me that, it's a way that when we're talking about, again, Native American wellness and tradition and culture, this is one of the things that we teach our children, and we will always teach our children our tradition and ways, even though we may have, a change now, a change in paradigm and change in the ways we think, and we can simply merge, those ways and those culture. It's not that we have to have a genocide. It's of tradition of, of gathering, even if it's gathering spiritually and educationally, to learn each other's ways and to grow. And I think once we get that implanted into the youth and the kids that are, struggling these days, and I agree, toward Martinez, we've had, kids that have left because of the they get ostracized in school, they get alienated, they get separated because, one culture thinks that we are separate, that we're different. But when I speak, I talk about a land before borders, before jurisdictions, that we are all a people that were able to go wherever we please, to migrate, to harvest, to hunt, no matter where you came from, even if you're from across the ocean. So that is what, I speak on, is being able to respect and teach each other's culture, because cultural awareness, once you know the awareness of each other's culture and you teach our young ones about cultures from anywhere, I think that lessens the divide, because once somebody thinks that you're different from another, that, creates a violent tone in their mind. So we have to be able to understand each other. We have to teach kids that, everyone has an origin and everyone has a culture, and we need to respect that. Again, when we talk about the kids, and even when they grow into adulthood, when they get separated, because we've been separated as Native Americans from our culture, like we said, with boarding schools, the separation. I have elders in my tribe today that come to our meeting and they say that, they were taken away when they were young, and they never learned the language and they never learned the culture. And we respect that. They're still Native. We still respect them as tribal members, even though, they don't know the culture or the history, and they've come back. They've been able to be as adults and come back. Some of them have been separated so much that they've had to do research to come back and find where they're from, been adopted out so many times, and we've accepted them. And now they're learning the culture. But again, even as adults, we have members that have committed crimes and gone to prison, and that, is also something that they become separated because there isn't enough cultural tradition teaching in the prison system. So all of that, I think, again, just my point is that we get cultural awareness and education throughout the entire system, and especially with the youth. Once we learn that and the youth get a hold of it, I think they have a sense of belonging. With this suicide and missing murder, it's just something that we need to address, and as soon as we can. But again, that's my take on it. Thank you, Assemblyman Marianne, Chairman, Chairwoman. Thank you, everyone.
Thank you, Chairman, and thank you for bringing to light, really know the history of the people that you're trying to reach. History of colonization, history that still impacts California's first people, and accepting who we are as Indian people could be a first step to trying to identify resources that are needed within the tribal communities. Next, we're going to go to the Vice Chair of the Pala Tribal Government, Brandon Johnson.
Thank you, Assemblymember Ramos. Glad I could be here today. Morongo, thank you for hosting. I appreciate it. As a tribal leader, a newly tribal leader myself, I've dealt with, I can echo all our tribal leaders. We all dealt with, situations on our reservations, and it's hard to see. And I believe with the fact of, one word I hear a lot is awareness, and being prepared for all of it is having those programs that we've had on the reservations for our youth is huge. I mean, I believe it impacts them a lot, and nothing's done overnight. So when you have one program one time and then it's no funding for another, it's gone. It's not there for them to, look into it even more. So I believe that's the focus that I mean, as far as Paula goes, and I see with it is the youth and letting them understand on how there's help there, and you can ask, and as tribal leaders, being prepared to show them and do it. I was told one time, as tribal leaders, I'm not going to tell you what to do, but I'm just going to prepare you for what can happen. And that's what we're here for, I believe, is prepare them for what's there. This situation of, suicide and mental health, both in line with each other, and it's a huge problem throughout Indian country and my neighboring tribes out of there. It's hard to see and to deal with when it comes to the youth. And I speak as a tribal leader on it too, but also speak as a father. I have teenage kids. I have that I hear stories from them to say, hey, my friend's doing this or my friend's doing that, and it's, well, who can they talk to? If they need somebody to talk to, come to me. And there's where is it at? Not only in Indian country, outside world stuff, but the Indian country that I have nieces, nephews, family members, everybody that deals with this stuff. And it's like, as a leader, you try to be there for them and do it and have the opportunity to lead them to a program if they need it. And that's where I believe where it stands on.
Thank you so much for that, and reaffirming the commitment, ongoing commitment, that if a program's started, that there's long-term commitment to ensure that resources are there and not forgotten about. I did want to see if Cahuilla tribal government did have a council member here, if they would like to say a few words. Oh yeah, Santa Rosa. Anyone from Santa Rosa?
Ramona is here.
If you would like to speak.
I'm actually from Santa Rosa.
I think you have to turn it
Yeah.
on, turn the microphone on.
I'm actually from Santa Rosa. I'm Linda Richardson, Tribal Council.
You can sit up here if you want on the dais.
No, that's fine. I'm okay out here.
All right.
I just wanted to kind of echo what I've heard I've come from a parent that was in and out of drug facilities, and just the effect that it had on us as children to watch your parent go through something like that in and out, it is long-term trauma. I would just say that, long-term trauma. And to be here to represent Santa Rosa Cahuilla and the young people there is a great honor, and to kind of decide what programs would actually be best for the young people there and who they can go to and the resources that need to be set up that they have access to is very critical. It's very, very critical because they don't know what to do. Just as me, I'm an adult with grown children now, but when we were coming up, we didn't know what to do. We didn't know who to go to. We didn't know how to handle those types of situations. So I just want to say I'm very happy to see this. And not only that, I think as a result, I kind of dived into the behavior health arena to kind of deal with people that were dealing with suicide and mental health issues. And so it's really become a passion of mine because of where I come from. So I just want to say thank you.
Thank you so much for your comments, and brings to light what is step one. Where do we turn to when tribal communities are faced with these situations that we're talking about here, mental health, suicide prevention, and living on, as former Chairwoman Marianne Andreas brought to light, failed attempts. That really brings everything to light. And we'll move now to our second component. Ramona, Tribal Council? We have to.
Good afternoon, everybody. I am Chairwoman Danae Hamilton Vega from Ramona Band of Cahuilla. You know, as a young tribal leader, it's interesting seeing things from two different perspectives. I was once a youth of our small tribe, and I was the only youth for the longest time. I watched the struggles of our older ones battling substance abuse and alcohol. Because of that, I made the decision of changing that. I wanted to show our younger youth, who are 10 years younger than me, that there is a chance, there is hope to change this route. It's a generational curse sometimes that we have endured. And because of that, it's been my mission, especially with our Native youth, to have that advocate for them, to show them they have a voice to speak up. Because of their struggles right now with parents who are absent because they're incarcerated or because they're in rehabs or just simply because they're, addicted to substance abuse or alcoholism. I had to show them along the way, like, you're not alone. It's okay to come to me. It's okay to speak up and ask questions on why this is what's happening. I understand from, having a parent who wasn't involved in my life. I, was raised by my grandparents who showed me a different route. They were very activated with the Native community, trying to help Native young men, women, to give them a chance that, we all make mistakes, but we can learn from that and we can prosper from that. So that is, Ramona's big thing that we've been trying to do with our kids, because I do have kids that are struggling. I have failed attempts with suicide or other scenarios with them. And that's why I'm here today, because I want to, bring this back to them and show them, like, there is something here. We are fighting for not just you, but for everybody. So I thank you for reaching out and, inviting me here. Thank you.
Thank you so much for bringing to light the struggle of our Native youth. And when you look at the statistics, you and all of us could agree that growing up as a Native youth is harder than many other groups here in the state of California. We do want to offer up one more comment if they so would choose, and it's Vivian Garcia, Tribal Community Liaisons with United American Indian involvement, if they would like to say a few words.
Who voluntold me? Well, hello, greetings, everybody. Oh, it worked that fast. Well, thank you for having us here. I'm representing United American Indian Involvement, who's joining me here today. Ramos, it's just a pleasure. I mean, I look up to all of you, and a young leader that I just followed on the mic. I'm just continuously honored to be, I guess, with that emerging group that's coming to the forefront to advocate. You know, I've been in LA all my life, city kid, relocation baby. We're out there. We have centers like UAII who are really creating that cultural hub, for example, that fosters that sense of belonging. So, Chairman, I mean, that's the key, I think, all of you have spoken to, is that sense of pride. And so I don't want to get moved to tears because it's a work of the heart for me to be representing UAII. They've done so much for me and my family. I don't think I'd be, oh, dang it, don't make me emotional. It's just a passion of mine to really see us overcome so much and to be united in these important issues that are just plaguing so much of our community. And I'm thinking of ideas, like as we speak, like how do we, we're in Hollywood, for crying out loud. Let's get some of these actors and cool people, let's campaign, let's make it a rally for life, because we're getting so caught up in our suffering, and it's just tough. It's tough being in a city, it's tough being in a reservation area with little access. I mean, I have a privilege of having so much access in such a big city, but the problems are still there. We do need to band together. We have to figure out a way to uplift the next generation, because it's becoming too much of a cycle that we're not seeking to clearly, and we're not reaching out for help when we need it. And so I think eliminating that stigma is the first thing we need to do, is just making our voice and our hand out very clear that we can overcome this together. But I guess I'm just figuring out what I can do personally in such a big urban area like LA. But it comes to this, like these roundtables, for example, and how we're gonna lean on each other to amplify our voice, have a more united voice, and of course, just keep advocating for what we need on and off the reservation. It's really important. And so thank you for volunteering me. I wasn't prepared to speak on this, but I'm a proud product of an urban city like LA, and UAII, I can't say enough about them, because they're really behind behavioral health in all ways possible. But this suicide issue is something, it's not talked about enough. And so I think we're on a good path right here, right now, sticking together and figuring it out, because we can't have the solution for our people. So thank you.
Thank you.
Thank you so much.
I do want to make the point that I was in speaking with Vivian earlier, that California is a very unique state in that because of relocation, almost half, if not more, of the tribal people living in California are non-California natives, but from other tribes.
Definitely, and brings to light what's needed in the state of California. Even when you look at the tribes here in the state, a lot of our tribal members live within the urban communities outside of the reservation boundaries. Mm-hmm. And so bringing all those things to light, how do we now tackle that issue? And you heard from the voices of California's First People, urban areas that do carry a high population of Native American people in them. So how do we elevate that voice? How do we include that voice in the discussions going on around the Office of Suicide Prevention? And now we'll move to our next component of this hearing, and it's with the Public Health Office of Suicide Prevention, incorporation of tribal needs and expectations into outreach plans and efforts. And we'll hear first from the California Health and Human Services Deputy Secretary of Behavioral Health, Stephanie Welch, who will join us remotely.
Good afternoon, Chairperson Ramos, members of the legislature and tribal chair people. Thank you for inviting us to join you today, and most importantly, to have an opportunity to hear directly from tribal leadership about what you're experiencing and what you're seeing in your communities. I am so disappointed that we could not be there in person. That's my sincere apologies, and also express those on behalf of Secretary Ghali and Dr. Bowie, who is leading our 988 planning efforts. They're on holiday, but I really want to underscore that if anything comes out of today that you hear from me, that we really welcome future opportunities for engagement. I'm going to speak to some of those in my remarks and move through them quickly so that there's plenty of time for our department to provide you some key updates. In my role, I serve as our primary advisor on behavioral health issues to the Secretary, and I want you to know that I really look forward to reporting back to him on some of the things that I heard today. I want to express my condolences for your losses and acknowledge that there's a lot of grief and pain in what I have heard in the last hour and a half. I also really want to appreciate and underscore that some of the things that were shared around the core importance of a sense of belonging, a sense of purpose, a feeling of acceptance. Sometimes we bundle these all up and would describe them as having a core sense of security. Those are pillars of strong mental health and well-being. And I think you really are on target with some of your comments about what you want to seek to create healthy and strong, and in particularly mentally healthy communities. So we'll talk a little bit about that in a minute. I also want to agree that your stories reflect the data that I'm becoming more and more familiar with every day, especially with the work that we're doing around 988 and the crisis care continuum, that suicide is the second leading cause of death of Native American people who are under the age of 34, and that our traditional behavioral health system has woefully failed Native American populations. There are high rates of suicide, there are high rates of self-harm, as I have heard in the room, and there are high rates of drug misuse and overdose. And frankly, that's also coupled with low utilization of behavioral health services. And when I see statistics around low utilization of behavioral health services, that's on us. We're not offering something that's helpful. Indigenous people broadly experience psychological distress and are much more likely to seek help from spiritual and or traditional healers. I heard that as well as a theme in some of the comments. And that behavioral health services have not traditionally reflected an acceptance of those cultural and linguistic and geographical diversity that's needed to address the needs of Native American communities. I'm going to pause there. Can you hear me okay?
We hear you fine.
Okay, great. We're embarking on a new, I wouldn't say new, but bundling up many of our behavioral health efforts in what we're calling mental health care for all. And that really truly means all of us, and it needs to be inclusive of California Native Americans. Everybody should have access to affordable, equitable, and most importantly, culturally responsive mental health and substance use disorders. This administration, in partnership with much of the leadership of Assemblymember Ramos and all of the work of the Native American caucus members, to consistently bring to our attention that we could do more when it comes to behavioral health policy. But we also need to make sure that we are engaging with all of you and understanding what your needs are. We all know this, that at this point, far out from the early days of the pandemic, that the pandemic itself exposed so it exposed that there were really significant, and I say really significant disparities in the experience of both having a behavioral health condition and getting the appropriate treatment for that. And those disparities were also significant when it came to geographically small and more isolated or rural communities versus urban communities. So over the time I've been in this working for Secretary Ghali for about 4 years now, we have worked hard with the support of the legislature. I really want to underscore to really make a lot of significant investments. And today I just wanted to provide a few key updates before I transition over to our Department of Public Health. First and foremost, and you guys mentioned it in some of your comments, there simply isn't the infrastructure. There isn't a there. There aren't the services, whether you are an urban Indian or you're a Native American who's residing on the reservation here in California. There just simply isn't access to care. And so I think one of the things that has been a top priority for us is our behavioral health continuum infrastructure program. That program, which predates Prop 1, but we'll get there in a moment, dedicated $2.2 billion to build out the behavioral health continuum. 5% of all funds are required to go to tribal entities. And there are many examples of exciting work that's being done, including some investments to over 23 tribal grantees, resulting in 54 new tribal vehicles that will be doing tribal mobile crisis. There are other examples, and I wanted to share with you all that we are creating a document for you so that we can spend our time talking and not maybe going through as many of the details. And of course, your team knows where to find all of us, and we can always take follow-up questions. But what really wanted to acknowledge and also congratulate and support continued seeking of these funds for infrastructure for you all to build your own to serve the populations that you care about in your communities. So we have had another 6 actual awards that will be building new facilities on tribal lands or in partnership with organizations that serve urban Native Americans. And so very excited about that. And that's, we'll come back to talk about how that program is continuing with additional funding as part of the implementation of Prop 1. But again, there is a required treble set aside, and then above that set aside, people can apply for more money in the pool of people who are applying and competing for funds to build new facilities, from outpatient to actual treatment beds. The other thing that I was asked to talk about today that I'm very excited about is the work that our agency is leading on implementing 988 and the crisis care continuum. When we wrote the state strategic plan on suicide prevention, which is called the Crisis Care Continuum Plan several years ago, there was an emphasis on wanting to address the needs of Native Americans and Alaskan Natives because of what we've been talking about today, these high rates, these negative outcomes such as suicide and suicide attempts and self-harming behavior. So 988 is this intended to be easy to remember 3-digit number that anyone can call who's experiencing a suicidal crisis or some other mental health or substance use related crisis. Even people who are worried about a loved one who might be experiencing crisis can also call to receive guidance and support. And this is a national effort, but here in California, we're really trying to build out the entire crisis system so that it's not just about having a place to call, but it's having someone to respond. And in this case, very importantly, someone to respond in a culturally responsive way. And then to have some sort of treatment, some sort of follow-up. How do you help this person who's experiencing this crisis? And so we're developing a 5-year plan to realize that vision. And how would we make that happen here in California? We're very lucky to have some representation from tribal leadership on our advisory group through Robert Smith, the chairman of the Pala Band of Mission Indians, and also some clinical expertise, which has been really helpful with some clinical staff from Two Feathers Native American Family Services. But the most exciting part of this work is that we're working with Kaufman and Associates on a whole tribal engagement process that kicked off earlier this summer. And that team of advisors is made up of the California Rural Indian Health Board, the California Consortium for Urban Indian Health, and the Native Dads Network. And what we're doing is having lists that you have mentioned are the things that we're hearing in our early readouts. We don't have enough resources. Individuals who are even manning those calls may not be appropriately trained or adequately trained in how to interact with people who identify as Native American. And so we are looking forward to learning more as those continue. Kaufman and the team, our 90-day tribal team, are going to develop a comprehensive summary and an assessment of gaps and needs in tribal communities. Also, we'll do an assessment of tribal emergency medical service capacity, as well as barriers that to Native tribal mental health care. And we'll identify a list of different groups and stakeholders and allies that we should be working with on an ongoing level as we continue to do this work. I hope to be able to take that information, to come back to this group, to the caucus, share what we learn, and have conversations about how we move forward. I just want to speak real quickly before I pass it to my colleagues about comments that were made about Prop 1 and the Behavioral Health Services Act. As I mentioned at the top, I think there's tremendous opportunities for our tribal partners to grow their own capacity with our bond. As you may know, again, there's a tribal set aside. We have $4.4 billion, 1.5 of it is earmarked for cities and counties, and 300 million of that is just for tribes. I want to just again underscore that that's earmarked and a must. I think that is a floor. We want to support our tribes to apply and to successfully apply and compete for the rest of those dollars. And I'm sure we can have lots of offline conversations about ideas and ways in which to do that. Secondly, I really want to lift up, since you mentioned engagement, that the local planning process includes tribal and Indian health program designees established for Medi-Cal tribal consultation purposes to be a part of this process and to be mentioned in the plans. So we have a lot of work to do to make sure that that happens at the local level, and would love your partnership in that. But we really want to make sure, as you mentioned, got to be at the table to have these decisions at the local, or these conversations and planning at the local level. And then finally, to really be responsive, I think, to some of the things you were mentioning about addressing historical trauma, to really the healing arts, and making sure that you will have the capacity to heal your own with what makes sense in your culture. We have an expanded focus on trying to address these disparities that I had mentioned earlier. And that's everything from resources to expand community-defined practices, to also really looking at stratified data and actually requiring some local reporting at the county level on how we are reducing disparities and improving outcomes for particular high-need, high-risk populations. And so those are just a few examples. I apologize for the technical difficulties and further apologize for not being there. I look forward to working with you in the future and being a partner. And at this point, I can pass it back to you, Chairman, but also I can just pass it directly to my colleagues at CDPH, the California Department of Public Health.
Yes, go ahead and have them speak.
Thank you so much. Chair Ramos, members of the legislature and tribal chairs, thank you for inviting us here today to discuss our work in the CDPH Office of Suicide Prevention and our engagement with tribal partners more broadly. My name is Christine Shador, and I'm the Assistant Director here at CDPH, and we envision a future made up of healthy communities with thriving families and individuals. CDPH has an Office of Health Equity that was established in 2012 to provide a strategic role within the department to reduce physical and mental health disparities experienced by vulnerable communities in California. The Deputy Director of this office also serves as the department's tribal liaison. The Office of Health Equity's priorities include building partnerships and consulting with stakeholders to ensure that community perspectives and input are included in our policies, strategic plans, and implementation activities to improve the health status and equity of all populations. Some of our work in tribal affairs, we do recognize the breadth and diversity of California's tribal populations and understand as the American Indian and Alaska Native population size grows in California, so does the need to address the health disparities for this population. Our work through the COVID-19 pandemic made evident that CDPH needed to develop an infrastructure and resources to effectively engage with and respond to the needs of California's tribal partners. We've created the Tribal Health Equity Program, which provides ongoing coordination between state resources and tribal communities on health equity issues pertaining to COVID-19 and other related issues, including data sharing. And we have also recently established, with the support of the Future of Public Health Funds, the Tribal Health Equity Advisory Group, to provide a forum for tribal communities to communicate needs and engage in policy consultation. The THEAG consists of 12 members that are of tribal or American Indian Alaska Native descent with lived or professional experience serving tribal communities. There's California and non-California tribal representation from across the state. The group held their first meeting in June and will meet bi-monthly. And the purpose of the THEAG is to function as a strategic partner to CDPH to provide guidance to our programs and services on effectively meeting the needs of tribal communities in California. The focus on our focus will be on public health and upstream factors that contribute to health inequities in tribal communities, and to serve as a bridge between CDPH and our tribal communities. In addition to the outreach activities related to Behavioral Health and Services Act and the Office of Suicide Prevention, which we'll speak to very shortly, CDPH engages with tribal communities on a variety of subject matters. I just want to make sure you're hearing me, so I'm going to ask for me to do a sound check.
Yes, we hear you.
So CDPH convenes a quarterly tribal data work group with CDPH staff and tribal partners to address the need for data and access to data pertaining to Native American population. The purpose of the work group is to center tribal communities' expertise and voices and allow for discussion on how to accurately represent lived experiences in reported metrics. CDPH has also awarded multiple grants to tribes and tribal health groups, namely 15 grants that were awarded to tribal health programs and urban Indian health programs to implement a community health worker program to promote COVID-19 vaccine efforts in tribal communities with the highest risk of transmission. And we also provided an award to the California Rural Indian Health Board to contract to provide technical assistance to these grantees. We are also participating in tribal events to offer climate and health-related technical assistance for tribes across California. And we're executing several contracts on climate-related health issues, such as supporting the development of tribal heat mitigation plans and development of a climate and health vulnerability assessment. In coordination with the California Reducing Disparities Act, CDPH has also awarded grants to tribal organizations in a statewide prevention and early intervention efforts to reduce mental health disparities in vulnerable populations. There are other examples of our engagement with tribes throughout CDPH, but I know we're limited on time, and I want to assure Ashley has the opportunity to discuss the Office of Suicide Prevention. I just really want to reiterate that we take the concerns of our tribal partners seriously and with humility. I hope that we can continue learning about ways the department can continue to work with you to improve health outcomes among American Indian Alaska Native populations. We look forward to our ongoing engagement. And now I'll turn it over to Ashley Mills, who will talk about specific prevention activities, suicide prevention activities.
Thank you so much. Just want to do a quick sound check. Make sure that people can hear me in the room.
We hear you fine.
Fine.
Great, thank you. Thank you so much for the invitation to join you this afternoon. Chair Ramos, tribal chairs, and members of the legislature, my name is Ashley Mills, and I am the Community Wellness Assistant Deputy Director within the Center for Healthy Communities at the California Department of Public Health. I oversee the Office of Suicide Prevention. I am also former staff to the Mental Health Services Oversight and Accountability Commission, where, as a staff person, I was the primary author of Striving for Zero, California's strategic plan for suicide prevention. Thanks to Assembly Member Ramos's efforts in getting Assembly Bill 2112 enacted, the Office of Suicide Prevention provides technical assistance on best practices, conducts state-level assessments, monitors and disseminates data, convenes community partners and other experts, reports on progress, and includes a focus on groups at high risk for suicide, including Native Americans, in particular Native youth. We also implement strategies that are consistent with those outlined in Striving for Zero. My presentation today will highlight the Office of Suicide Prevention's Native American suicide prevention activities and partnerships. Native youth are one of 3 focus populations in the Office of Suicide Prevention's Youth Suicide Prevention Campaign and Outreach Strategy, which was launched in March of this year. As a component of the Children and Youth Behavioral Health Initiative, Never a Bother is a youth suicide prevention media and outreach campaign, which focuses on Native American, African American, Black, and Latino youth and their parents, caregivers, and allies. The Office of Suicide Prevention partnered with the Sierra Native Alliance in Auburn, California, to premiere the campaign in March of this year. This launch included Native youth and elder speakers, ceremonial dances, and traditionally prepared food. The Sierra Native Alliance is one of 9 tribal entities and 25 community-based organizations partnering with the Office of Suicide Prevention as trusted messengers in their communities and delivering local youth suicide prevention strategies. The Office of Suicide Prevention also launched, as part of the Children and Youth Behavioral Health Initiative, a youth suicide reporting and crisis response pilot program designed to pilot county-level approaches to rapidly report and respond to youth suicides and suicide attempts. 10 counties are participating: Alameda, El Dorado, Humboldt, Kern, Los Angeles, Riverside, Sacramento, San Diego, San Joaquin, and Solano counties. Humboldt County has developed a direct partnership with local tribal entities, the Yurok Tribal Courts Youth at Risk Program and the United Indian Health Services Youth Suicide Prevention Program, to ensure that Native youth are included in program efforts. The Office of Suicide Prevention also facilitates the distribution of lockboxes to support reducing access to lethal means, such as firearms, medications, and other drugs. In 2024, lockboxes were offered to tribal entities throughout the state, resulting in 37 tribal entities requesting a total of 3,350 lockboxes, which will be distributed later this summer. The Office of Suicide Prevention releases an annual Suicide and Self-Harm Emergency Department Visit Data Trends Report each September in recognition of Suicide Prevention Awareness Month. The September 2023 report highlighted how suicide rates in Native American communities more than doubled from 2020 to 2021. This finding also was highlighted at the Office of Suicide Prevention's annual Suicide Prevention Awareness Month webinar, and in September of 2023, the Tribal Information Sharing Meeting that was hosted by the California Department of Public Health's Office of Health Equity in partnership with the California Health and Human Services Agency. The Office of Suicide Prevention produces and disseminates several suicide and self-harm data resources and reports throughout the year that are focused on disproportionately impacted populations, including but not limited to data briefs on suicide amongst veterans and older adults, and an annual fact sheet and infographic. Additional data briefs are planned for release in 2024. The Office of Suicide Prevention creates and disseminates annual suicide and self-harm emergency department visit county profiles to each of our California's 58 counties. These profiles represent county-specific data and are shared with local health jurisdictions, county behavioral health departments, and county offices of education to support program planning and decision-making at the local level. The Office of Suicide Prevention also disseminates data via various dashboards, including our Epicenter, our California Violent Death Reporting System, Suicide Data Dashboard, and the Firearm Injury Data Dashboard. The Office of Suicide Prevention has been strategizing on the best way to disseminate more detailed data on tribal populations and has sought support from the Centers for Disease Control and Prevention and the Office of Health Equity within the California Department of Public Health, given various challenges associated with tribal data, such as small counts in subpopulations that may lead to unreliable rates, and the need to suppress data to meet de-identification guidelines and to protect personal identifying information. In 2023, the Office of Suicide Prevention hosted a virtual community of practice webinar for local health jurisdictions and county behavioral health departments with high rates of suicide and self-harm, intended to promote and support local efforts to engage tribes in suicide prevention efforts within those communities. Presentations and resources from the Department of Social Services, Office of Tribal Affairs were shared during that convening. Based on input from partners, the Office of Suicide Prevention has expanded to hosting quarterly communities of practice webinars in 2024 that are offered through partners across the state. In 2023, the Office of Suicide Prevention began to routinely participate in monthly tribal information sharing meetings hosted by the California Health and Human Services Agency and the Department's Office of Health Equity. Through these meetings, the Office of Suicide Prevention shared resources, data, and funding opportunities focused on suicide prevention with tribal partners and those who work to support tribal populations. These connections made at these meetings, the Office of Suicide Prevention also began to engage and establish partnerships with organizations focused on promotion of health among tribal populations, such as the California Consortium for Urban Indian Health. The Office of Suicide Prevention participated in the Northern California 988 Tribal Summit that was held in March of 2023, as well as the California Native American Day at the state capitol in September of 2023. Participation in similar events is planned for this year, 2024. In 2023, the Office of Suicide Prevention began to participate in the California Department of Veteran Affairs, CalVet, California Veterans Health Initiative, a comprehensive, coordinated, statewide approach to ending veteran suicide. Given that Native Americans are the most populous demographic among our California veterans, the Office of Suicide Prevention has connected CalVet to the Office of Health Equity within the Department of Public Health, their tribal information sharing group, and shared funding and resource opportunities from the Veterans Health Initiative with this group as well. In addition to participation in the Northern California 988 Tribal Summit that I described previously, the Office of Suicide Prevention participates in subject matter expert work groups convened by the California Health and Human Services Agency to develop recommendations for a 5-year implementation plan for the comprehensive 988 system, including components specific to tribal populations and other cultural and linguistic considerations, as described by Deputy Secretary Walsh. Thank you for the opportunity to present today. I look forward to continuing our partnership and learning as we move forward. Thank you.
Well, thank you so much for that presentation and working through the technical difficulties, but it's vital information. And we'll get contact information from you that we could post on our site so that people that are listening and tribal leaders will know more about those committees and the outreach that's being done to tribal communities, both to tribal governments and also rural communities. So thank you so much for that. As now we move to the Mental Health Services Oversight and Accountability Commission with Executive Director of Mental Health Services, Toby Ewing, who's here with us in person. And thank you for taking that flight down here. And I know we've worked hard together on mental health components in the state of California and hearings in Sacramento on these topics that are here. You heard the voices of the leaders of those that are here from tribal governments and also from the agency. How do we now take that and engage it moving forward, especially since we know that Prop 1 has been approved? How do we now be at the table in the beginning to ensure that voices that are being heard here on this dais and the resounding comment of making sure that there's a long-term plan, not something short-lived where it comes into Indian country and then disappears, and understanding the cultural aspect of who we are and acceptance of our culture, How do we now move forward with the presentations from the agency and now moving forward with your presentation?
Thank you, Chairman Ramos. Appreciate the chance to be here. Toby Ewing on behalf of the state's Mental Health Commission. And I also want to thank the Morongo Band of Mission Indians for hosting this event. Thank you. Let's get the mic right. I also just want to highlight a comment from the Ramona Tribal Chairwoman who said, the takeaway I said is her comment about we have hope. And I think that is so important in terms of working through some of the issues that you put before us. I think most challenging is the comment about years, decades, century of research, but without the action. And want to sort of put that counterpoint to the Tribal Chairwoman's comment about we have hope. Proposition 1, as you have pointed out, has passed, and it creates some tremendous opportunities to learn from what we've done over the past 20 years under the Mental Health Services Act and rethink and redesign some of our strategies. And I appreciate the comments from Deputy Secretary Stephanie Welch around the ways in which they're working to carve out opportunities for tribes to make decisions in terms of how these monies are used by you, as well as to engage better in the decisions that are made on programs that are happening through county behavioral health agencies or state agencies. There are a handful of opportunities that the state is working on over the next 6, 12 to 18 months, depending on what the issue is, particularly around prevention. So the state has made a historic commitment in population-based prevention. And there's some work that has to be done through the Department of Public Health to frame out what that looks like. And we can do better to make sure that we listen to tribal partners and tribal communities around what population-based prevention means for you. And so in addition to the opportunities that the Deputy Secretary laid out there, it will be important for the state to engage with you and other tribes across California, reflecting the diversity, urban and rural, northern and southern, around how a prevention strategy that could be rolled out that really captures the voices of your communities in ways that will be impactful. Key message that you have left me with today is we need to start with your voices and reflect your voices in the work that is happening throughout the behavioral health system. Chairman Tortes, I appreciate you holding the mirror up to those folks who were in your home as a child and holding that mirror up to us today. Similarly, the state has established new expectations for early intervention with authority to the Department of Healthcare Services to establish standards for how local behavioral health authorities, mostly counties, use quite significant levels of funding for early intervention. And as those standards are developed, it will be important that tribal voices are at the table to be clear and reflective that the list of early intervention strategies was really built from the perspective of the people that are being served. We have not necessarily done our work on the user experience as well as we should, and this is an opportunity to do that and to do that better. The state is making historic investments in workforce. And that's important for a couple of reasons in response to the comments that I heard from you today, both in terms of building out the capacity for culturally competent care within our behavioral health system and bringing jobs to your communities. And so the state has opportunities to leverage its new workforce investments in ways that we can build upon our success of the last couple of decades in the behavioral health space, but also recognize areas where we can improve. And I think you've pointed out several areas where we need to improve. The Health and Human Services Agency is building out an accountability system, and you heard some comments from my colleagues in the Department of Public Health around data and making sure that the data we gather reflect the unique needs of tribal communities, that we recognize the diversity within tribal communities as well, and that our accountability systems reflect not just overall population-based trends, for example, in suicide, but really drill deep into what's happening in locations across the state based on geography, based on race, ethnicity, gender, sexual orientation, and other issues that are important within the communities that you all represent. Clearly, community engagement is important. It has been a pillar of the Mental Health Services Act. It continues to be a pillar of Proposition 1, and I am the first to say that we have not done as well as we need to do in terms of listening to our community and tailoring our responses to the community, as evidenced by the outcomes that we're seeing today, including the outcomes that we're talking about in terms of youth suicide, but suicide more broadly. Innovation is another area where the Commission has new opportunities to lead an innovation strategy, and that innovation is really focused on addressing areas where we need to do better, where we don't necessarily have evidence-based or effective practices. And the Commission's conversations to date have been about focusing innovation investments on reducing disparities. And so we have a lot of work to do to understand what those opportunities are and how we will pursue them with the resources that will come to the Commission in about a year and a half. I will say that one of your messages very clearly is really engaging the leaders within tribal members themselves to lead, right? And so I mentioned to Assemblymember Ramos that the governor will be making new appointments to the state's Behavioral Health Commission. And many of those seats have certain qualifying criteria. And many of those criteria are open to tribal members if there is interest. Local behavioral health boards also there also are appointments to local behavioral health boards which help advise county behavioral health departments in how they make spending decisions and even who they hire in terms of behavioral health directors. So those are very broad. I also want to share a handful of opportunities that the chairperson of this Behavioral Health Commission, Mara Madrigal-Weiss, asked me is we would like to work with you, particularly with you, Assemblymember Ramos, and the caucus, to identify all of the paths and tools that we have available, to identify those that you believe would be tailored to the needs that we're talking about today. We have recently invested about $1 million to elevate the voice of young people through youth-designed and youth-delivered behavioral health conferences. And so we're working with community partners, and we would welcome the opportunity to understand how we can best engage your youth. We strongly believe that elevating the voice of youth, peer-to-peer, as someone mentioned earlier today, is a key opportunity, and we want to make sure that those resources that are available now, the work on that is starting in the next couple of months, involves the tribes that are here today and your partners across the state. We are offering school mental health grants to elevate schools as centers of well-being, recognizing that schools not always, but can be trusted partners. It's often where children are. And so how do we strengthen opportunities for school mental health? We can do a better job making sure that those opportunities are apparent to our tribal partners and then responsive because you're more engaged and help us understand what we're doing right and what we're not doing right. We're doing other things that around communication, public engagement, advocacy. My boss has asked me to make sure that we sit down with you and develop a game plan to do a better job today and moving forward than we've done up until today. Mostly, I want to thank you for inviting us to come and to listen and to take notes and to sit down with you and hear what you're saying. And we ask you to hold us accountable. We are the Accountability Commission. And so we'd love to partner with you to figure out how not only can we do better in the work that we do, but as an advisory body to the governor and the legislature, and as an oversight entity for community behavioral health departments, how we can actually get to zero when it comes to suicide in California, consistent with the report that I think we made available to each of you, but more importantly, that we can achieve the broad-based goals of the Mental Health Services Act, under Prop 1, now the Behavioral Health Services Act, which are about improving employment, reducing the number of folks who are unhoused, reducing criminal justice involvement, keeping families connected, preventing suicide, supporting educational outcomes for young people, employment outcomes for adults, and preventing prolonged suffering. Thank you for the chance to join you. Certainly available to answer any questions you may have. And again, I really just appreciate the time you spent today.
Thank you so much for your presentation and those joining us remotely for their presentation. I want to thank you, Toby, for acknowledging that there's more needed on these boards as far as a voice from California's First People, but also the offer of a peer-to-peer and working with the tribal youth that the member from Ramona brought up about the youth and how growing up Native is harder in our community. So I believe maybe exchanging of communication, contact information of how we could then get engaged with our youth on a peer-to-peer type of advocacy, and bringing up the issue of Prop 1 early in its stages, making sure that those that are interested can apply to be on those boards that are being assembled, but to be able to be that voice and acknowledging that being attentive and engagement within California's First People is something that is going to be looked at as far as a priority moving forward in the future. And that's all we could ask, is that moving forward, that we're part of the discussion at the table. I also want to thank the Deputy Secretary, Ms. Welsh, for bringing up the ability to have follow-up discussions with the caucus and with the tribal community to show the progress of what's being done. We also want to be able to move forward in a dialogue with periodic updates of how California Indian people and the tribal communities in the state are moving forward. Certainly hearing about lockboxes is great, but we want to make sure that there's ongoing efforts within the community and that we truly are bringing that gap of that data and that statistic of the high rates of suicide, mental health components within California's First People and Native people are here in the state of California, that we're closing that gap. We shouldn't be the highest statistic that's out there warning those areas. But you hear from the tribal leaders here that it goes way back into colonization, goes way back into historic trauma, and some would argue contemporary trauma that's still being inflicted upon our people. So I want to thank you for being here and your presentation and your staff and working with us over the years since we've been in the legislature identifying these issues, as well as the agency that joined us remotely and their offers to continue to work with us and to update us on the progress moving forward with engagement within the tribal community. We do want to open up the dais for any closing remarks from tribal leaders on the dais if they have any closing remarks. Go ahead, Councilwoman.
Samantha Thornsberry for Cuyah Band of Indians. The only question I had, or really a concern, is really thankful for the tribal set-aside. But when I hear the word compete, it always kind of gives me a little bit of heartburn, because oftentimes there'll be money that's available to do this good work, but then it becomes so competitive, and different tribes, different organizations have different abilities and access to help to go after this funding. So then you create almost its own disparity for some. That was really my only comment or question about how that might work, because the word competitive was used when talking about that tribal set-aside.
Go ahead. If we could.
It would be wonderful if I could get your support in connecting to the tribal leader who's speaking to make sure that we can, for one, this is why these are such wonderful opportunities, so I can go back and ask what we're doing through that particular process, because I'm sure that they have some sensitivity to this. We did have many applications through our previous round of this work, so it's a good flag for me. I appreciate the question. I'll go back and not only find out what we offer in terms of technical assistance and support, so that people can apply, specific to supporting our tribes. And then also I can follow up directly with the person speaking to make sure you have that information.
Thank you for that. And I'm not sure if you can share information in the chat, if that would be there, or our office will get you that information to ensure you have the proper contact. Thank you. Chairman Torres?
Yes, thank you, Assemblyman. Yeah, Mr. Ewing, we appreciate, your being here and the statement of being able to work with us. And I do think that, Native Americans should be, as soon as possible, on the board, as you suggested, or on any appointments, especially with the commission or in developing a report like this. But I just did a search on the report, or California Strategic Plan, Suicide Prevention, and it is perfect. It's a good document, talks about in general, what we can do together as prevention for suicide. But if we do have a member on the board, then we could incorporate, like we've been striving for as long as I remember, and that's inclusion, to have tribal member representative on a report like this, right? I mean, and you've heard everything that we've had to say, but I think the next report would be very successful if we have natives in here, with the word search on natives on the report. It only talks about, it talks about the statistics and alternatives, right? So, and I think about alter and native, but it's natives and change, right? I mean, that's how we change, just by growing together and changing, right, and implementing. But I think the next report, would be really great, and including tribal members on the commission and in the report, and I think that would make us together more successful. Thank you.
Thank you so much. Any others wishing to speak? Closing remarks, tribal leaders? Well, we want to thank all the presenters for taking the time to be here with us, those in person, those remotely, and for your offers of making sure that progress is updated to the caucus, and making sure that contact information is passed through the Cahuilla tribal government to the Deputy Secretary that are here with us. We also have now within the public area, we did have a series of hearings. This is not something new to the Native American community, or even holding a hearing of this topic of mental health and suicide prevention. We've had it prior, and we had members from D.D. Hirsch here talking about the 988 number, and in that hearing it talked about how another state included a 988 number dedicated straight to cultural sensitivity to Native Americans. That's something that we continue to strive for here in the state of California. And I know that during public comment they were going to say a few words, but I would bring them up to the microphone now to say a few words within the D.D. Hirsch and 988, and have them speak a little bit to what's gone on in Washington for a dedicated 988 Native American line.
Good afternoon, everyone. And first and foremost, I just want to thank you all for inviting us to be part of this hearing and summit today, specifically welcoming us onto your lands to talk about this important issue. It's important to all of us. My name is Sherry Sinwalski, and I'm Vice President of Crisis Care at D. Hirsch Mental Health Services. We are a community mental health organization based in Los Angeles, that provides a lot of services related to suicide, both in LA, but also through telehealth and hotlines across the state of California. We're one of the 988 crisis line providers for the state of California, one of over 200 in the country. It's interesting that we're having this meeting today when yesterday was the anniversary, the 2-year anniversary of the launch of 988. And I believe that 988 was conceptualized under the hope that we would provide greater access to care for everyone. The concept of a 3-digit number being easy to remember for someone to call in when they're in crisis. And, you know, over the last 2 years, I think that many things have been done to increase access to that hotline, including there are different modalities that people can use, including the hotline, chat, and text, available 24/7. Those other modalities are very appealing to younger people especially. There are things like Press 1 for veterans, Press 2 for Spanish, Press 3 for LGBTQ. And in the state of Washington, as my wonderful colleague Rochelle, I think, is going to talk about in a moment, it is a wonderful pilot specifically for Native communities to Press 4 to reach 988 counselors that are part of their own community where they may feel safer and more willing to access care. We know that when a person is in a mental health crisis or even worse, thinking about suicide, it's hard for any person to say, I'm thinking about ending my own life and I need help right now. And then if we have structures in place that are not accessible for every community because of mistrust or because of lack of knowledge that that service exists, it's even more challenging. And we recognize that is a barrier to access to care for the Native communities. And so at D.D. Hirsch, we've been really thankful that we've been invited to these conversations. We were part of the summits last year in Sacramento here and at Morongo. We're grateful to be working with Riverside San Bernardino Indian Health to look at ways that 988 can be more accessible. So in this moment, somebody who might call 988, hopefully the counselor on the line will be more aware of sensitivities or things that might help them to be a better listener for someone who's calling in from the Native community. But we also recognize that might not be enough. If Native American community members don't know about 988, that's a problem. We need to get the word out. But if they don't trust it or they don't want to use it, it doesn't matter how well the counselors are trained on the other line. And so we are very open and eager to explore options like a Press 4 option here in California. If we can learn from our colleagues in Washington, and if that's what service is deemed to be most necessary or accessible here in our state, we would love to have more conversations and talk about that. I just wanted to also end by saying that we offer many services at D.D. Hirsch. We have a suicide prevention center, and I've heard several people mention today the trauma and the challenges and how horrible it is when someone survives a suicide attempt. And we do at D.D. Hirsch offer peer support groups for people who have survived a suicide attempt, and I heard some stories of some really challenging medical challenges that have been the result of those attempts, but there's also many emotional challenges that people face after having had a suicide attempt. And it's really unique, the peer support groups that we operate, because it's facilitated by people who have had a suicide attempt. And so it's a welcoming and warm environment for people to not feel like they're alone in that, or to feel like an additional stigma of having gone through that experience. And while I recognize that there are probably lots of things within the structure of D.D. Hirsch that might not allow or encourage or even have that resource, be known in the Native American communities, we are also more than willing to talk and explore, are there things that we've learned in that process that might be helpful for you? Are there things that you all know that we might incorporate into that to make those services more accessible? So I guess in closing, I'll just say that we welcome the partnership. We're very happy to be in this conversation again. We'll be here after this is over, and we've got information about the resources that are available through D.D. Hirsch. And thank you so much for allowing us to be part of this conversation.
Thank you so much. Rochelle?
Hello everybody, it's good to be here again in Morongo. Uklasish Sainoaksakul Ashas MT. Rochelle Hamilton, Uklas Lamamutli MT Ihadis Akso. My name is Rochelle Hamilton, that is my English name. My traditional name is Sainoaksa, meaning faraway woman. I am an enrolled member of the Hadisat First Nation, which I'm sure you're not familiar with, Northern Vancouver Island, British Columbia, Canada, so the other CA. I am also a descendant of the Tulalip tribes in Washington State. I live on the reservation there. I'm here as representative for Kaufman and Associates today, and I just kind of want to tell you how excited I am. First of all, hearing from all of the powerful tribal leadership voices is so important. I have been conducting conversations around California with our youth, our urban population, our rural population. So I quite literally was here last week, and I am talking to tribal people, other tribal people, to figure out what California wants. Because again, we often come to these meetings and we say, we have a plan, we're gonna work together, we're gonna do this. But as some of the chair people here said today, it's like, but what happened? Like, what happened? We have this incredible opportunity in California. California being, I think someone said like, hey, this is Hollywood. Like, we have all these really great opportunities here. And California is a leader in so many things. Actually listening, we say, we want to hear your voice, right? We're listening right now. I'm quite literally out there listening to tribal voices. Hearing all of yours was so important because these are the recommendations that are coming from everywhere. Everything that our tribal elders want is what our tribal youth want. The tribal youth, they know exactly what they need. They are reaching out and they're saying, hey, older generation, we need to know that it's okay for us to start talking to reduce the stigma. Our young people know that. And so I'm talking with them now, and every single thing that you all have said is what the people are saying. Whether they're urban, rural, it doesn't matter. Everybody has the same thought, so we finally have this opportunity to do something. In Washington State, we do have the 988 Press 4 option for the Native and Strong Lifeline. That is my baby. I'm very proud of it. It is something that actually happened, an action that came out of listening to tribal people's voices. Importantly, it might not be the same thing for California, but everyone here, every tribal person here has to know about it. That's why I'm here, that's why I'm doing this work, because it is fair that everybody across Indian country should know that there is something that is possible. It has been done in Washington State. Nobody can say that it can't be done. We included in Washington State all the tribal voices. There are 29 federally recognized tribes there. My understanding there are 109 federally recognized tribes here and a ton of urban Indian populations. There's no reason why all of those tribes can't talk and get together, at least to know that we're all wanted at the table. We get those Dear Tribal Leader letters, like, okay, again, but we have to know that we're wanted and welcome, and we have to do these things in our territories like we're doing today. So I'm just really, really thankful to be here again at Morongo, one of my favorite places. I absolutely love it. Thank you for having me, and again, let's just actually start doing some stuff. Let's take some action steps.
Agreed.
Chew.
Thank you so much for that. And thank you for leading the discussion on the 988 hotline that would be specific to Native Americans here in the state of California. And I want to acknowledge Deputy Secretary of Behavioral Health, Stephanie Walsh, who chatted in that you're working with her also on some of these issues. So I wanted to show that there is that work that's being done and the outreach that's there. But I think hearing directly and bringing that discussion to Indian country here in the state of California is drastically needed. The word peer-to-peer continued to be heard, and we heard from the councilwoman from Ramona as far as our youth and their voices feel that the resources aren't there. But I think now would be the time to listen to peer-to-peer, not trying to solve a problem without that voice, but bring that voice into the equation first and build from there. I think that's where we're all headed. So I want to thank all the presenters for being here and the tribal leaders who took the time to be here to talk on this issue. This is a hearing that we assembled from the state, so we are going to offer up public comment. If you feels so inclined to make public comment on this topic, please state your name and limit yourself to 2 minutes, please.
Hey, good afternoon, Assemblymember Ramos, and I want to thank you for this opportunity to be here today. My name is Bill Thompson, CEO with Riverside San Bernardino County Indian Health. Also, Tribal Council Member Andreas, I want to thank the Morongo Band of Mission Indians for hosting this conversation here today.
Good to see you.
Earlier today, I received an email from the California Department of Healthcare Services regarding the Prop 1 bond and the Behavioral Health Services Continuum Infrastructure Program. And so that's a $3.3 million competitive grant funding opportunity. And as Samantha mentioned earlier, that term or that word competitive does cause me a bit of concern. I hope there is a carve out for Indian health programs. And I hope that carve-out allows all of the Indian health programs here in California to apply for that grant and receive the adequate funds that they're going to need in order to provide the services that we need to provide for our communities that we serve. You know, yesterday, Samantha, I had a conversation with one of my staff regarding the domestic violence program, which you're familiar with. It's a necessary program. This conversation that we're having here today is a necessary conversation. The term that was used earlier, accountability, this conversation is going to hold all of us accountable to make sure that this program succeeds in the ways that our community needs it to succeed. I believe that the behavioral health staff that we have within Riverside San Bernardino County Indian Health is as great as the need for that doctor in that exam room with those patients. Our behavioral health staff is so stretched thin, it adversely impacts their ability to serve the community members that they need to, sometimes almost 7 days a week. We will be applying for that grant, and it's going to be a challenge because we are going to be competing against others, but I hope that our success with that grant brings the success that we need for our patients that we serve. Unfortunately, twice in my lifetime with Riverside, I've received 2 phone calls from mothers who are grieving over the loss of their children. It were telephone calls that I was not expecting to take or to receive, but feeling the grief and hearing the grief when they're talking about the loss of their children due to suicide was something that I never expected to hear. But it also inspired me a little bit more to make sure that we're able to deliver the services that we can to those that are in need. It takes a strong person and a strong family to come forward and seek out help. And that's the first step in regards to moving forward. But at the same time, every single day, that family or that individual is going to live with what they went through at that particular time. But overcoming that, it is just not an individual. It's got to be a family. It's got to be a community. So thank you for this opportunity. I appreciate it.
Thank you so much for your comments.
Oh, I'm sorry. One more thing. Sorry. Our behavioral health department, they are organizing a suicide resiliency conference sometime in September. I don't have all the details yet, and I don't want to publicly provide all the details, but I'm proud of our behavioral health department because of that step that they're taking in order to serve our communities. Thank you. I'm done.
Thank you.
Hello everyone, my name is Charlene Harrison and I am Homo Paiute and Navajo, registered Walker River Paiute out of Shares, Nevada. My clans are Kia'ani, born for the Shush people, so that's on my Navajo side. I want to thank you for the invitation here today. I am co-CEO of United American Indian Involvement in Los Angeles. I'm over healthcare services. And I wanted to, Urbans have entered the chat, and so what we see ourselves as an extension of the tribes. We are here to be partners in taking care of tribal members who reside in Los Angeles County. And I'm sure you all know Los Angeles County is 4,000 square miles and 88 cities, and we're the sole urban Indian organization in the county. And to my colleague's point, you know, talking about staffing, we have maybe 5 behavioral health providers in our organization. And so I just wanted to add that as a variable to the conversation when we're thinking about hiring. So we can build programs, we can build systems, we can build workflows, we can have crisis vehicles, but we need people to drive them. We need people people who are going to be able to show up and carry a panel. And so that's one of the struggles that we have in our organization is the staffing for those. But we are looking for partnerships. I want to invite you all there to come and see us as an organization, because we do really see ourselves as an extension of taking care of the tribes for the county. And so we're looking to you for partnerships and for support so we can continue to do the services for the next 50 years. We just celebrated our 50th and we're very proud of that. So thank you very much for the invitation, and I'll be waiting for you guys to come to come visit. Thank you.
Thank you, and thank you for your tireless work serving our communities.
Good afternoon, my name is Kimberly Barraza. I'm District Director for Assemblymember Eduardo Garcia. Thank you for the invitation to speak at this hearing. We deeply appreciate Assemblymember James Ramos, the Mental Health Services Oversight and Accountability Commission, and the California Department of Public Health Office of Suicide Prevention for hosting and participating in this vital discussion. As we strive for zero, I want to reaffirm Assemblymember Garcia's unwavering commitment to expanding affordable, equitable, and culturally responsible behavioral health services, particularly for our tribal populations who face unique challenges. We recognize the urgent need to address mental health disparities and ensure that every individual has access to the support they need. On a personal note, if I may, this cause is very, very close to my heart. As a mother, I have faced the horrible experience of my teen daughter attempting suicide twice within a 2-year period. This personal journey has only strengthened my will to advocate for better mental health services, resources, and support systems for all families within our community. It encouraged me to take action, and I ran for office, right? Because that's what you do, right? When needs fixing, support, you run for office. And so I ran to be elected at the Desert Healthcare District. In my role as board member for the Desert Healthcare District, I've been fortunate to spearhead efforts to enhance behavioral health services. Since 2018, our district has allocated significant funds to support mental health initiatives, including a $3 million investment to improve access to behavioral health services. We led the Coachella Valley Behavioral Health Collective in collaboration with the Riverside University Health System, Behavioral Health, and Assemblymember Garcia's office, uniting 38 organizations to address mental health needs in our community. Our district's 5-year strategic plan further emphasizes our dedication to this cause, with a clear goal to proactively expand access to behavioral health services. This initiative is vital to creating sustainable and equitable mental health infrastructure in the Coachella Valley. And we are committed to continuing this work and look forward to future collaboration within the state as we support these initiatives and programs. Thank you again for the opportunity to speak today. Together, let us strive for a future where every individual feels supported, valued, and heard. Thank you.
Thank you. Thank you so much, and for your personal testimony.
Good afternoon. My name is Orban Hansen. I'm the Chief Executive Officer at Indian Health Council. So we're a consortium of the 9 tribes of North San Diego County, Liceño, Kumeyaay, Kuya, and Capeño. So first of all, thanks for the invitation, Assemblymember Ramos, and thank you to the Morongo Band for having this roundtable and discussion. Thank you, tribal leaders, for your stories and input. It was really good to sit and listen. We hear a lot from our boards, from our community, but so good to knock home just the ongoing story of the need for behavioral health services and how it ties into everything we do in our tribal health programs, from integrated care to, and I see so many partners here, right? We have the most complicated health system, I think, in every state, with tribal health programs, urban Indian health programs, tribal organizations, and we work together for that common good. So I want the state to hear that. So the reason I want to hear it is I'll start with Prop 1, right? So Proposition 1, we've heard it. We were one of the few that worked with our county on the tribal side, and we've had a prevention and early intervention grant since 2009. So we're very excited to see what Prop 1's going to do now with the Behavioral Health Services Act and what it means to tribes and tribal health programs and urban Indian health programs. So we again want to make sure that that word competitive scares us, right? We want to work in partnership. We don't want to take funding. We want to make sure there's equitable funding throughout. So I wanted to make that statement, and also wanted to emphasize, just like with MHSA, as the state rolls out Prop 1, is bring the tribes, bring the tribal health programs, bring the urban Indian health program to the table on the scope. You heard loud and clear, I heard it, right? Culture is medicine. Have us be involved with what works in Indian country as we develop prevention, early intervention, ongoing aftercare. We want to be at that table and work with the state to make sure that Prop 1 is successful for the tribal communities we serve. I just want to take a second on 988. So that's another, so 988 has been a really interesting rollout, right? Very complicated. So we went for a grant through SAMHSA, right, on the federal side, and we received that grant for our consortium. So I just want to emphasize that partnership with ongoing groups, right, and maybe some more unified communication. I know Chairman Smith is on there from the California side, but just maybe some more, maybe another summit on the southern side. I know a lot of us are also associate members of California Rural Indian Health Board. I know a lot of the urbans through Kukui and Kaufman Associate. We just want to make sure as we have these different scopes of work to do the same goal, right? Is to make sure we take those calls, we're able to get it to the right people and to respond right in Indian country. And I think that's at the end, but it's confusing on the players involved and to make sure that we're unified as we get 988 rolling out, especially in Southern California. So just one more thing on funding. So it's not only competition, it's complexity, right? So word back to the state, as tribal set-asides go aside, we're gonna work together through the tribal health programs of tribes and the tribal organizations to get overall services out to our communities. But if we can work on the simplicity of funding, right, to get those funds, do they always have to go down through the counties to get to the tribal organizations? Maybe looking at Prop 1 as something to set aside. Maybe some money can go straight through California Department of Public Health and come down to the tribal program of tribes, rather than going back through the counties like it did with Prop 63 at the start in MHSA. Just to look at some options there. And last thing, loud and clear, you're going to hear from all of us, and thanks for talking on it. Workforce development for behavioral health. We are struggling. Even if we do get funded, it's just so hard to recruit and to keep qualified good behavioral health SUD personnel at our sites. So that ongoing partnership of not only funding, but partnering to make sure we get good quality Native American and others at our tribal and urban Indian health programs for services. So thank you again for your time.
Thank you so much for your comments. Any other public comment? I just want to thank all those who participated and really appreciate the efforts to be here remotely with us and working with us through our technical difficulties, but we got the presentation done. And just to shed a little light on the word competitiveness within these grants, it's another historical area when the Bureau of Indian Affairs put out grants and we all had to compete with one another to go after that funding. That's why you're hearing so much about the word competitive with the grants and why it's bringing an awareness around the tribal leaders when they hear that term. So I just wanted to bring that to light of why that is moving forward in the fashion that it is. Also, want to again pick up where when the public comment speakers spoke as far as funding trickling through the county boards of supervisors and then to the tribal communities. Tribal governments are a government, and we would look to the agency and those that are in those positions to see tribal governments as a government-to-government relationship that would be able to hopefully get to a point to where direct funding is something that could be done. These are areas that we still know that we need to educate those in the state in these different areas and positions they have, but also we're having these hearings. And as the chair of the California Native American Legislative Caucus, part of our big role is education around these issues, education around the topics that are there. But here in the state of California, we are home to more individual tribal members than any other state in the nation. Those are those that are California Indian people and those that are not. So we know that over 70% of the Native American people population in the state of California live outside of the tribal boundaries of federally recognized tribes. So there's a great need that's out in the community. So being able to look at those infrastructures that are there and to follow up again on one of the public comments as far as silos being created to address this issue, it's time that we put those silos away and work together to see what infrastructure is there and what the need truly is. So I do want to thank the Morongo tribal government for opening up their chambers for us to have this public hearing on the topic of suicide prevention and mental health, and to all the tribal leaders that participated here at this dais and on the Zoom. Thank you for your voices to be heard. It's time that our voices be heard as California Indian people, not as an afterthought, but in the beginning. Hear about who we are as Indian people and then build from there. It's time that our voices resonate within the policies that are being developed and certainly amongst the boards that are making decisions on how to bring resources to California's First People and Native American people residing in the state of California. Thank you so much. This select committee hearing is adjourned.